Breakdown. 1. The real difference between type 1 and type 2 diabetes. To understand why medicines like Mounjaro and Ozempic matter, you first need to know how diabetes works. Type 1 diabetes is an autoimmune condition. The immune system mistakenly destroys the insulin-producing beta cells in the pancreas. As a result, people with type 1 can't make insulin at all. They need insulin injections for life. No oral medicine or weekly injection can replace insulin for type 1. Type 2 diabetes is very different. Here, the body still makes insulin, but it doesn't use it properly. This is called insulin resistance. Over time, the pancreas can't keep up, leading to high blood sugar. Type 2 diabetes is more common in adults, especially those who are overweight, inactive, or have a family history of the disease. Both Mounjaro and Ozempic are designed to treat type 2 diabetes, not type 1. 2. What Mounjaro is and how it works inside the body. Mounjaro, with the generic name tirzepatide, is one of the newest treatments approved for type 2 diabetes. What makes it unique is that it works on two different hormones. GLP-1, glucagon-like peptide 1. GIP, glucose-dependent insulinotropic polypeptide. These hormones help regulate how the body handles food. By mimicking both, Mounjaro improves insulin release, lowers blood sugar, slows digestion, and reduces appetite. Think of it as giving your body a double boost in controlling sugar and weight. 3. What Ozempic is and why it's popular. Ozempic, with the generic name semaglutide, has been around longer and quickly became a household name. It belongs to the GLP-1 receptor agonist family of drugs. Ozempic copies the action of the GLP-1 hormone. It helps the pancreas release insulin when blood sugar is high. It slows down food leaving the stomach, preventing sharp sugar spikes after meals. It also reduces hunger, helping with weight loss. Because of its effectiveness and heart protective benefits, Ozempic is one of the most widely prescribed diabetes injections today. 4. How both injections lower blood sugar and help you regain control. Both Mounjaro and Ozempic work in similar ways to lower blood sugar. They stimulate insulin release only when blood sugar is high, reducing the risk of low blood sugar. They lower glucagon, a hormone that tells the liver to release stored sugar. This prevents unnecessary sugar flooding into the blood. They slow digestion, so food enters the bloodstream more gradually. They reduce appetite, which naturally helps with weight control. Together, these effects make it much easier to maintain healthy glucose levels, something oral medicines often struggle to achieve alone. 5. The surprising role these medicines play in weight loss. For many people with type 2 diabetes, weight is a big challenge. Excess fat around the liver and pancreas worsens insulin resistance. By reducing appetite and slowing digestion, both injections help patients eat less without feeling deprived. Clinical trials show people lose 10 to 15% of body weight with Ozempic. With Mounjaro, the weight loss can be even greater, sometimes over 20% of body weight in certain patients. This is more than just cosmetic. Losing weight can improve insulin sensitivity, lower blood pressure, reduce cholesterol, and even help some patients put their diabetes into remission. 6. The added heart health benefits that could save your life. Diabetes doesn't just affect blood sugar. It greatly increases the risk of heart attack and stroke. That's why cardiologists pay close attention to diabetes treatments. Ozempic has been proven in large studies to reduce the risk of major heart problems, including heart attack, stroke, and cardiovascular death. Mounjaro is still being studied, but early evidence suggests it may also improve heart outcomes. This makes these injections especially valuable, because they don't just lower sugar, they protect your heart as well. 7. The side effects you must watch out for. While powerful, these medications are not free of side effects. The most common ones include nausea and upset stomach, vomiting, diarrhea or constipation, fatigue or dizziness in the beginning. Usually, these symptoms improve as the body adjusts. Doctors often start with a low dose and gradually increase to minimize discomfort. Rare but serious side effects include pancreatitis, inflammation of the pancreas, gallbladder problems, a potential risk for thyroid tumors in certain people. That's why it's critical to take them under a doctor's supervision. 8. Mounjaro versus Ozempic. Which one may be better for you? So which should you choose? The answer depends on your health needs. Ozempic has a longer track record, proven heart protection, and strong effectiveness. Mounjaro is newer, but early trials show it may be more powerful for both blood sugar and weight loss because of its dual hormone action. Some patients respond better to one than the other, so doctors may try Ozempic first, then switch to Mounjaro if more improvement is needed. 9. Who should consider these treatments and who should avoid them? These injections may be considered if you have type 2 diabetes and your blood sugar is not well controlled with diet, exercise, or pills. Struggle with excess weight that worsens insulin resistance. Have risk factors for heart disease and need added protection. But they are not for everyone. You should avoid them if you have type 1 diabetes, have a history of pancreatitis, have certain thyroid conditions or family history of thyroid cancer, are pregnant or planning pregnancy. Again, the decision must be personalized by your doctor. 10. The lifestyle habits that still matter. Even with powerful medications like Mounjaro and Ozempic, healthy habits are the foundation of diabetes care. These include balanced eating, prioritize vegetables, lean protein, whole grains, and healthy fats. Limit processed foods and sugar. Regular exercise, even 30 minutes of walking a day improves insulin sensitivity. Adequate sleep, poor sleep raises stress hormones and blood sugar. Stress management, yoga, meditation, or simply deep breathing can help keep sugar steady. Medications make the journey easier, but lifestyle is what builds long-term success. White heavy checkmark closing summary. So in this part, you've learned the difference between type 1 and type 2 diabetes, what Mounjaro and Ozempic are, and how they work, their role in lowering sugar and helping with weight loss, their added heart benefits, the side effects and safety considerations, a clear comparison between the two, and why lifestyle choices still remain essential. Together, these injections are game changers for type 2 diabetes. They won't replace healthy living, but they can transform your ability to manage this condition and live a fuller, healthier life. If you found this deep dive helpful, don't forget to subscribe, hit the notification bell, and share this video with someone who may benefit. And as always, talk to your doctor before making any decisions about your treatment plan.